Today I want to talk about God and dentistry. What does God have to do with dentistry? Have you ever done surgery on a cadaver and then gone back a few weeks later to see if the surgery healed? It never does because the body's not alive. Now, I did a lot of surgery yesterday and about 5 weeks ago and about 2 months ago, and I'm not with those patients right now, but they're still healing. What's causing them to heal? It's not me because I'm a good surgeon. It's something greater than me. You can call that God, you can call that spirituality, you can call that nature. It's all the same thing, but it's not us. It's not me as a human being that put that wound together, is causing those capillaries to bud, and the connective tissue to form, and the bone to calcify, etc. So it's basically God's rules. Now, why am I bringing up God? Because patients today are in a rush. Everybody today is in a rush. We're in a very fast society. There's not much of a attention span. We're going. New graduates from dental school today don't realize that there was anybody that came before them. They don't realize that there was a Leonardo da Vinci and a Napoleon and a Louis Pasteur and a Brandon Mart. They don't realize that all these people came before us to create all the things that we're doing today. Matter of fact, a lot of my colleagues don't even go to lectures anymore. They just look at Instagram and they scroll through it and they go, oh, I'm going to learn this, I'm going to learn this. And oftentimes they're learning it from somebody who's only been out of school 1 or 2 years. Oftentimes I'll give a lecture and someone will come up to me, a young person. I remember this young good-looking guy from Redona Beach in California comes up to me and goes, man, I can't believe you can grow bone like that. He goes, I thought that was a zygomatic case. Now, the things that I show are things that we've been doing for 30 or 40 years, but everybody's now is talking about other types of procedures. They think that's important. So people are going faster. And patients are pushing us. If you go into TV today, you'll see all sorts of advertisements for drugs. The United States is the only country in the world that has pharmaceutical companies putting advertisements on there so that patients can go to their doctor and say, I want this drug, I want this prescription, I want Pradaxa, I want Cialis, I want whatever it is that they're advertising. That doesn't happen in other countries. So the United States, our patients are pushing us even more than other countries. And it bugs me. You know why it bugs me? Because they're pushing me to do the wrong thing. Patient goes, I saw an ad on TV that people got their teeth taken out, implants placed in teeth the same day. Well, yes, I do that, and I can do that, but in your case, I can't do that. He goes, shouldn't I go to one of these clinics? If you want, you can, but not every patient is a candidate for that type of treatment. Sometimes it takes time. Now, my average patient, when they come into my practice, I take out a tooth, I perform a bone graft, I wait 3 to 4 months, I place the implant, I wait 3 months, I uncover it, I wait 1 month, I place a provisional, I wait 3 months, and then they're done with treatment. That's a lot of treatment. Well, I do 2 or 3 of these a day in my practice with very consistent good results. Now, I'm probably an outlier that I'm a little slower than most, and I frequently will tell my patients that I'm the most experienced but slowest implant dentist in the United States. I'm slower than everybody else, but my results are consistent because I'm following biological rules. So I remember once I was giving a lecture at the Oral Surgery Academy, their implant academy, that takes place every January in Chicago. And I'd finished my lecture a little early. And I'm looking at the oral surgeons, and I'm a periodontist, and the oral surgeons, look at me as being, different type of a specialty. Maybe I'm not as sophisticated. Maybe I don't do all the big bone grafts that they do. And I said, some of you may be going to do these very large cases and going very quickly. But when a patient says to me, Mike, can't you do it any faster? I will look them, and I'll look them right in the eye, and I say to them, I wish I could, but I can't. And they look at me and they go, why can't you? I go, because it's not up to me. And they go, who's it up to? I go, these aren't my rules, they're God's rules. Now, when I say something like that to a patient, they just stop for some reason. Nobody believes in God in the United States, but if you say God, people go say, oh, better not say anything. Now, I'm joking. Some people do believe in God. I believe in God. A lot of people do. But it's something that people just don't mess around. You can't talk about politics. You can't talk about religion. I think that's still true today. So when I say to a patient, it's not up to me, it's God's rules, the patients usually say, oh, I understand. I said, this is biological rules. Now, I am not a rule follower. Okay, I'm an outlier. I'll do exactly what I want to do. I don't care what anybody else has to say. If I believe it, I'm going to do that. The only rules I follow are God's rules. And what are God's rules? They're biological rules. I can't push my patients to go faster because I have to wait for the biology to catch up with their healing. And all too often, I see so many cases in my office, too many, of people violating biological rules to do things faster because the patient is pushing him. I have been on a podium with other colleagues and have said to me, I said to them, I go, you know, you're doing a lot of immediate implants. I see a lot of bone loss down to the second or third thread. You're getting soft tissue loss there. You're not doing everything ideally. And they go, I wish I could, but I can't. I go, why? He goes, because if I just take out the tooth, somebody else is going to do the implant. Or if I don't take out the tooth and do the implant, I'm going to lose the patient. My concern is not losing the patient because I'm doing it the wrong way. Okay? I'm going to do it the right way because it's the right way. And I don't want to violate that. I don't want to violate biological rules. So as I think it's important that you really stand clear, and sometimes it's hard to do. Sometimes it's hard to do the right thing. If it was easy to do the right thing, everybody would doing it. But if you do the right thing, I believe that you'll be practicing in a practice that has great integrity and people will trust you. I never lose patients because it's going to take another 3 months to do it the right way in my office. Matter of fact, they send their friends and family to see me. And because of that, I'm actually booked up 4 months in advance without any advertising, just by doing the right thing with the people that I serve. So remember, it's not our rules, it's biological rules. And if you want to use the God's rules thing, go ahead and do it. You'll be the gift to your patients. Have a great day, everybody.